Thank you, Chairwoman Holmes-Norton and Ranking Member Davis, other committee members here. I'm Scott Bogren. I'm the Executive Director of the Community Transportation Association of America. It's a national nonprofit association of about 1,500 rural, small city, tribal, specialized services serving older adults and people with disabilities and non-emergency medical transportation providers and advocates, and it's really great to be a part of this important discussion. The process of making a collection of transportation and mobility services respond to an individual's trip needs using emerging and existing technologies is really the central truth of mobility on demand. And it really fundamentally changes the traditional transit dynamic from asking the customer to fit their trip to an existing system or provider, and instead asks how the existing transit mobility service can best meet the needs of an individual and a passenger. CTAA members have long understood this, having done pioneering work in accessible transportation with the ADA, services for older adults, veterans, in tribal communities, and in meeting the non-emergency healthcare needs of patients. Rural and specialized transit systems virtually invented the notion of demand response transportation about 30 years ago. And when those systems were invented, there was always a notion of like a 24 or a 48-hour advance notice kind of window to get those trips. And today, on demand means on demand. And really we're asking and working with a lot of our members to kind of leave behind that notion of the window of 24 and 48 hours. For smaller transit operators, the successes we're seeing in adapting on-demand mobility is built around outcomes with specific purposes in mind that can be measured and evaluated. Specifically, these examples tend to address increasing mobility options and reducing isolation, which oftentimes leads to increases in ridership, driving down the cost of healthcare, achieving better results in human service delivery, and enhancing community and public transportation efficiency. In Vermont, one of our members, the state's Agency on Transportation, is currently using an FTA MOD sandbox grant to develop an interoperable open source data feed using, get in the weeds here a little bit, GTFS Flex, which really allows the state to, for the first time, take demand response operations and weave them together with traditional fixed route in a trip planning mode. And what it gets rid of is when somebody in rural Vermont wants to use a Google trip planner, something saying because there's no fixed route bus, there's no transit available, when in fact there is transit available. So far, in about 2 months of use, 1,500 unique users are now using that service in Vermont, and we know we're going to see a lot of additional usage. In Flint, Michigan, one of our members has a system called Rides to Wellness, which is a mobility on demand service. It's provided 10,000 trips last month in sedans. That system, which was the winner of our Urban Transit System of the Year, has developed 15 partner agencies and is helping local healthcare systems reduce no-shows and with late-night discharge. And these are some of the trip demands that I think can be met with good, effective mobility on demand. Plans are underway currently in Flint to expand the service to veterans in Genesee County and also to neighboring Shiawassee and Lapeer counties. In central Oklahoma, specifically Oklahoma County, the Arnall Family Foundation and state human service leaders knew they needed to address the mobility challenges in increasing successful reunifications of biological parents with children placed in the state's foster care system. CTAA has partnered with the fixed route operator in Oklahoma City, Embark, and the Oklahoma Transit Association to win the grant. And we are currently in the process of developing on-demand mobility using technology and a network to help reunify biological parents with their children in foster care. These are just some of the examples of the innovative work underway around the country that's turning mobility on demand from a promising concept into a reality. It's essential that the FAST Act's successor provide the continued federal investment and even incentives to continue the progress we're seeing across the country in mobility on demand.
Thank you, Mr. Bogren.
Thank you.